What's up, fellow knowledge seekers? Today we're going to be talking about Addison's disease in the canine. So, Addison's disease is a disease of the adrenal glands, which are going to be situated craniomedially to the kidneys, which are outlined in blue right there. So, the adrenal glands are going to secrete two steroid hormones of interest, the first one being aldosterone, and the second one being cortisol. Both of these steroid hormones are going to be secreted in different portions of the adrenal cortex. Cortisol being produced in the zona fasciculata, while aldosterone is produced in the zona glomerulosa. Now, there's two metabolic pathways that we have to worry about when looking at these steroid hormones. The first one being RAAS, which stands for renin-angiotensin-aldosterone system, and the second being the HPA-axis, or hypothalamic-pituitary-adrenal axis. Now, the way the RAAS pathway is going to work is the liver will have produced a protein called angiotensinogen, which will be in general circulation. When the kidneys receive signaling to attempt to raise blood pressure, it will secrete an enzyme called renin. Renin will cleave angiotensinogen into angiotensin 1. When angiotensin 1 circulates through the lungs, it will get cleaved by an enzyme called ACE, which will then produce angiotensin 2. Angiotensin 2 will then signal to the adrenal gland to secrete aldosterone. So for the HPA-axis, what you're going to have is some sort of stimulation to the hypothalamus. This could be stress, this could be low cortisol, and what that's going to do is cause the hypothalamus to release CRH, or corticotropin-releasing hormone. CRH is then going to travel to the anterior pituitary gland, where it's going to signal for the secretion of ACTH, or adrenocorticotropin hormone. ACTH will then travel through circulation to the adrenal gland, where it will signal for the adrenal cortex to secrete cortisol. So now I kind of want to talk about some of the functions and characteristics of aldosterone. So this is a steroid hormone, specifically a mineralocorticoid, and it's going to be secreted in the adrenal cortex, specifically the zona glomerulosa, and its function is going to be to regulate osmolarity of the distal convoluted tubules in the kidneys, as well as the collecting ducts. So this is going to change whether or not sodium or potassium and water is going to be reabsorbed. So now we're going to take a look at one of the nephrons of the kidneys. So you can see here that I've highlighted the distal convoluted tubule in blue, as well as one of the collecting ducts in blue as well. So when aldosterone is present, essentially what it's going to do is tell the distal convoluted tubule as well as the collecting duct to reabsorb sodium and water and excrete potassium. Now let's take a look at cortisol. So cortisol is also a steroid hormone, but it is a glucocorticoid. Its source is the adrenal gland, but the zona fasciculata. Now, the functions of cortisol are really going to depend on what cells it's interacting with. So for like liver cells, like the hepatic cells, it is going to stimulate gluconeogenesis, which is the synthesis of glucose by the liver. If it's in muscle cells, it's really going to trigger proteolysis, which is the breakdown of proteins to amino acids. If it's in fat tissue, like adipose tissue, it's going to stimulate lipolysis, so the breakdown of fats for energy. Cortisol does also have some hemodynamic regulation, specifically with blood pressure. So cortisol will upregulate alpha-1 adrenergic receptors, causing vasoconstriction. And there are other things cortisol does, but these are just some of the basics. So another fact about cortisol is it does act as an anti-inflammatory towards the general immune system. So it is going to inhibit prostaglandins, leukotrienes, and it will inhibit interleukin-2, which will reduce the production of white blood cells. So let's talk about some of the general symptoms of Addison's disease. So first one being recurrent episodes of gastroenteritis, so vomiting or diarrhea. Another possible symptom is slow progressive loss of body condition, so BCS score. 3, failure to respond appropriately to stimuli. And then some of the characteristic alterations in the serum levels if blood work was done would be hyponatremia, hyperkalemia, and hypochloremia. And then dependent on the severity of hyperkalemia, there may be irregularities of wave function on an ECG, bradycardia, or both. So the gold standard diagnostic to test for Addison's disease is to run an ACTH stim test. So the general idea of this test is to draw for a baseline cortisol, get a value, and then give a drug that's going to be like a synthetic version of ACTH to stimulate the adrenal glands. You give that injection, Then you wait an appropriate amount of time, usually it's within 1 to 2 hours, and then you draw again to see if that essentially that drug has stimulated the adrenal glands. If there is no stimulation, that gives you a general idea that the adrenal glands are not responding appropriately to this drug, which does provide evidence for Addison's disease. Other diagnostic tools that could be helpful with diagnosing Addison's disease would be an electrolyte panel, as noted before, abnormalities of electrolyte values such as hyponatremia, hyperkalemia, or even a sodium-potassium ratio of less than 25 to 1 could help identify this. Again, the ECG is also a helpful tool with recognizing abnormalities of wave function that could be a result of hyperkalemia. So when looking at treatment, it's really going to be correcting for all the abnormalities. So this is going to include the following. So placing an IV catheter, starting an infusion of 0.9% saline to try to correct for some of those electrolyte imbalances. That's going to help correct for some of that hypovolemia that's the result of the nephron's inability to reuptake water. Correcting any hypoglycemia that the patient might have with ideally IV dextrose, as well as giving the patient an injection of a steroid such as dexamethasone sodium phosphate to manage that initial deficiency. So in terms of what this looks like to treat Addison's disease long term is really just a continuation of replacement therapy. Using some sort of mineral corticoid such as DOCP to help control electrolyte balances, as well as giving glucocorticoids such as prednisone to correct for abnormal cortisol values. Alright guys, so that's Addison's disease in a nutshell. Thank you all for watching, especially those who made it all the way through the video. Until next time guys, thanks.